Welcome to the Weld Together podcast, where we share stories of what's possible when people in a community come together for good. In 2024, a study found that 10% of Colorado households were defined as being in poverty, but this study did not account for an additional 26% that are also in financial hardship. This means that they may have to make hard decisions between things like paying the bills or filling the car with gas to go to work. These households are known as ALICE. That's an acronym that stands for Asset Limited, Income Constrained, and Employed. It means that these families, while they are working and employed, just don't make enough to cover their basic needs and expenses. At United Way of Weld County, we like to say that you also know Alice. Alice could be your local grocery store cashier, neighbor, care aide, or childcare provider. And some of us have also been Alice too. Because Alice households often don't qualify for aid or other social programs, they can often remain invisible. And that's why we wanted to shine a light on what it means to live in an Alice household and how we as a collective can help our neighbors have a better chance at succeeding. I have a special guest joining us today. I'm very happy to welcome on the podcast Pooh May. She has an incredible story to share. Thank you so much, Pooh May. It's really wonderful to have you on the podcast.
Yeah, I'm happy to be here.
Why don't we begin? When did you first come to Weld County?
Closer to like 2010-11-ish. My parents' job is what brought us here because we used to live together back home. And then when we leave from Burma, when we moved here, it's all like separated us from like each other.
So your family, your whole family then is from the Thailand border?
Yes, Burma-Thailand border, yeah.
So for those folks who may not understand what that situation was like and why you left, can you share a little bit about what life was like for you on the Thailand border?
My mom, flee from Burma to Thailand border to stay there. She was living there. She was pregnant with me already. That's when the war started. I remember she was telling me she has to walk 3 days, 3 nights to get to where she was at.
Wow.
But she was almost like full term. When I went back to Burma for my first trip. I saw how hard the road was. And I was riding in the back of a car. So I cannot imagine walking because it was like in the forest, it was up and down. And especially when it's rainy season, it was so hard to walk because it would be like very slippery and you have to grab onto things. And she had me, not only like me, she also has to carry all of her household stuff. And when she was pregnant with me, she was not married. And my biological dad left her. So she was all alone.
So your mom is pregnant with you. She's almost to full term. And now she has to walk through a rainy forest over, are those streets paved?
They're just like the regular mountains with full of like, there's no road. No, you just have to walk. She was telling me of like how I guess I was so low to the point where I was pushing everything. Like she was having pelvic pain. I think I was just born like right after.
So where were you born?
In Thailand, there is no hospital, there's no clinic, there's nothing. It's just in a shelter. I would just say like it's just under like a bamboo, like that covered with leaf. Yes, that's where I was born. When we live in Thai border, we have, I can't remember if it's like American Red, is that what it's called?
Would it have been the Red Cross?
Yeah, the Red Cross. Yeah, they provided us food. So we have to have a paperwork saying that, like I exist.
Right.
And that's the paper that got us here too. You have to have a UN paperwork in order to be called as like people that will move there, because the UN people only recruit, or how do you say, like they only open up one every couple years.
Wow. I'm curious, what happened? You arrive at the Thai border, then what was the journey of coming to the US from there?
They will do an interview for us. There is like a process, a step. The first process called OPE. If you pass that process, then you go to DHS. And that's when they do like a thorough background check. And they also go do your health screening and They draw your blood. And then if we pass all of that, then the next step after DHS was training week. They train us.
Can you tell us just briefly about what it was like for you as a 13-year-old coming to the US and not knowing very much of the language, not having a prior warning, even of what you were coming into?
Yeah, so when I first moved here, at first I thought we were all going to be together. I didn't know there's 50 states here. So it was brand new. We had a, I guess, translator or a caseworker, but that was not our native language. He spoke our second language, which my dad speak a little, but not fluently. And I didn't speak any of that language. I know how to write like alphabet, but I had to learn quickly the alphabet to turn into like a conversation. My dad, he was actually in Delaware, and so he only come home once a month or sometime like every 2 months.
So when you came to the States then, you came with your siblings and your mom.
Whole family to New Jersey.
So you land in New Jersey from the Thai border.
Yes.
My goodness. And then you're placed in this home with a new family you've never met.
Yes, I had to step up in my dad's place. I feel like I have to grow up so quick because my dad is not there. I remember traveling around with my little dictionary book from school just to communicate words by words, not even a sentence. But I'm like, it's better than nothing. Like, this is all I have. And I feel like my life depend on this little dictionary book. And it was not even new. Like, it's like some page it was torn.
And so you came to Colorado, you said, because your parents found work in Weld County. Is that right?
Yes, JBS right here.
About how old were you when you came to Colorado?
Probably like 15.
So then you come to Colorado. It's another new place. You're still a teenager. That must have been just a really challenging time.
Yeah. Well, we lived with somebody for a little bit. And then right after my parents work, that's when we can finally rent an apartment to ourselves. I went to like middle school for 8th grade. And because of the language barrier, we got bullied there. And I remember I did not want to go to school. I think it was just how horrible middle school want me to give up everything. Like, I didn't want to go to school anymore. I remember I even skipped last day of school. Like, last day of school was supposed to be, because the last day of school for my kids right now, they're having fun. They're throwing a party.
Yes.
Like, having so much fun, but that was not for me.
Right.
Nobody was there to protect us. So I even skipped my last day of school. And then they were telling me, okay, now you have to go to high school. And I'm like, high school, that there will be even bigger people,
bullies.
Like, yes. And I did not want to go to school. But what kept me going was that if you're underage and if you're not going to school, your parents can get into trouble. My parents sacrificed to bring me here. And we barely have translator. And if they will be jobless and then we'll be homeless. So it was just all of that. And I'm like, okay, I have to just take that up. I just have to finish this. I remember my mom was telling me, instead of looking ahead of the whole year, just try to finish day by day and then it'll pass by. I went to high school and it was not as bad as what I thought. But I think it was to the point where I was able to stand up for myself. I used every words that I know. Junior year, that's when I start joining a club. I start playing other sports. And since I started my high school years, I know the teacher for 4 years now. So I have like somebody that I can go to with my dictionary, telling them how I feel. And they would be there for me. They would stand up for me. And then I remember I had this 2 teachers. They were so good to me. They're gym teacher, and there's 2 of them, to the point where they even pay for my uniform because I play tennis. My parents never showed up for any of my school stuff because they have work. And so I remember they showed up for me. They'll bring me like lunch, or they'll bring me snack or drinks. So that's how I finished my high school. They were amazing people that were looking out for me. They were like my second family. I'm really grateful for them. And I still stay in touch until today. Even after I get married and I have my kids.
That's amazing.
Yes.
The Weld Together podcast is brought to you by United Way of Weld County, building powerful partnerships to bring about lasting community-wide change. Learn more at www.unitedway-weld.org.
So So, what is life like for you now? I mean, now you're living here in Weld County. Now you have a family of your own.
It's easier now with the language and everything because I can go anywhere by myself now, and I know a lot of places. I'm not struggling anymore. I mean, not like physical, not like struggling, but of course, like it's looking on the financial side. Yes, I'm right in the middle.
When you say right in the middle, what does that mean?
With the income, it's so hard to because we are above the poverty line, is that what it's called? But
Mm-hmm.
then below, like not all the way there.
So, if I'm understanding, you're earning more income than the poverty line, but
Yes,
perhaps not enough income for what it is that you need, but
yes,
too much income in order to qualify for additional help. Mm.
yes. So so with that, it's hard because I have to take out like certain things that I wanted to do in order to cover for the whole bill because we have to buy our own insurance, like dental, like vision, and especially
Mm.
my kids, my middle one, he needs help. He can't see clearly, so we have to keep because usually like for me, I'm not gonna buy vision for myself because so that I can save a couple bucks.
So, are both you and your husband working?
No, just my husband.
Okay, so he
Um,
doesn't get the insurance through his work then.
yeah, he get it through his workplace, but we have to pay for it.
Right. And you also have a little one at home,
Yeah, a
just
little
had a
one.
baby.
Yes.
And how old is he now?
He will be 5 months on the 19th. I have two older boys
Yeah.
that are in soccer's, but I
Mhm.
also want them to try out for other sports just to explore other.
Mm,
But I couldn't afford the whole year. I just do
mm,
the summer
mm.
season.
So as you were saying, there are things that you're having to go without in order to make
Yes,
those opportunities available to your kids.
yes. Because for me, like, there's a lot of like I want to play volleyball in a league that they have a league here
Okay.
at
Yeah.
like Greeley Rec or Greeley Funplex because when we first got married, we have nothing. We start off with zero. We just build up.
So when you first got married, then you were able to be on Medicaid, and that was
Hmm.
a little assist because
Yes,
you didn't have enough to live on, and so Medicaid stepped in. But
y-
now that your husband is employed, you don't qualify for Medicaid. Is that
yes,
right? There are things that you're having to cut back on
yes,
because you don't have that additional support.
yeah. I have to do a regular vision checkup for my kids, and then especially like dental. And I don't know for some reason my kids' teeth they just want to act up.
Mm.
There's so many stuff. And then for my son, the glasses we have to pay out of pocket because they're not covering. I used to like I love going to the gym. But now I'm waiting. I'm very heavy now, so I want to go back. But going to the gym, I have to still take them with me, and I cannot
Mm-hmm.
leave them at home. And so and it's
Yeah.
very hot. And usually, like gym membership here, the lowest is $20, but you still have the annual fee too. And I was like, okay, like $20. I'm thinking so hard.
I'm curious if there is room for advancements for your husband. Does he have an opportunity to maybe get a promotion at work? What does that look like?
Right now, yeah, he's been trying for manager position, but we both started off with high school. So there was no way for us to get to college to get a degree. And our parents work, they get so low income that they cannot afford to pay us through college. And
Mm.
even though we get FAFSA, it's not going to be all. So that's why he has no background of like any degree. So it doesn't matter like how long he worked there. People, of course, are going to pick somebody who has a degree. But he tried a couple of times. But we also want him home too. And with where
Hmm.
he's working right now, if he become manager, he has to be on call most of the time.
Mm.
Because even right now, he worked 15 hours a day. So he worked night shift. He come home and then he would wake up like 30 minutes before his work and then he would just go to work. So we wouldn't see each other. Before he used to work 3 days. Now they make him work 4 days,
Mm.
Monday to Thursday. And then he's on call Sunday twice a month. And then he also have to do payroll, which take like a couple hours.
So he's not home very often then.
Mm-mm. That's why at this point, we're struggling, but I'm good with what he's making right now because I want his time. Like, I want him to be a part of family. My kids are still very little. And I
Yes.
don't want him to miss out on how his kid's going to grow up. Because when they grow up, like, he wouldn't be able to take them to game. So that's why I'm like, at this point, even if you don't get that, like, I'm still good. I want him to be around.
You would rather cut expenses now and have more time with your husband.
Yeah, because I've been through that. I've been going to like places alone. So I didn't want my kids to grow up not having us around. I remember feeling so lonely. So that's why for as much as he can, if he can be involved, like I want him to be involved because you can see your kid's face when you showed up and then they can see the both of you. Like I can feel them too, you know? I don't want them to go through the way that I'm going through because I know you cannot leave kids at home underage by themselves. And I can see other people who go after money so much that their kids, it doesn't turn out good. They're like high school drop off, they are on drug, you know, all this kind of stuff. And yeah, that's not something that I'm willing to trade just to make more money, you know?
Your sons are all so little, they do require you at home then. You're the full-time caretaker
Full time, yes.
for your three boys. So that would be also a challenge, wouldn't it? To even consider you going to work because then the question is, what do you do with the kids? Am I understanding that correct?
Yeah. Because right now I even have to buy formula. That's why I start picking up some part-time shifts, but I couldn't work anything last week because it was like I have one day after another, like always appointment. But I try to pick up some when my husband is home because he's not working Friday. So then I can work like one day.
If you could, if there was more income, what would look different about your life?
Well, like for me, I want to go to school. I still want to continue school. Yeah, something just to get me into started again because I want to be able to, how do you say, like, because what if like one day, what if my kids ask me like, why you're never in college? Like, why you don't have any degree? Because they'll be like, then we don't have to be in school, you know? Like, we don't have to be in school because you never had any. You've never been to university. Why would we have to be?
You want to set the example.
Yeah.
What would you study if you were to go back to school or college or university? What would you study?
I want to be looking into the medical field.
Tell me more. Why is that?
Well, right now, I already have my medical assistant certificate. So I just wanted to go down to that path because I already had some experience.
What did you enjoy about that work?
I remember my mom would go to the clinic and it's like so hard to find a translator. And sometimes they don't let us translate. They're like, we want a professional interpreter. But to the point where they cannot find anybody, they're like, okay, come in. Because medical feel like it's so important to understand every word, words by words. Like if you don't understand one word or if you mistranslate one word, like that, it's danger. Like everything is depending on that. So that's one thing that what led me to there. I remember a translator would be so mean to my parents and it's not even their native language. They translate it to Burmese and they would be like, how can you not understand this? I remember my mom was crying because of that translator. And so when I first started working in the medicine clinic, not a days go by that people didn't ask for my name. Yes, I'm not a translator. I'm a medical assistant. So I have a schedule that I need to run. But when they know that I'm there, they forget that I have to run my own schedule.
You're not like there as a translator, but they're asking you to be.
Yeah. They'll come to the front desk and like, we want her, you know? So I feel like I give them their heart at peace being there. Like I guess I make them feel more safer knowing that I'm there to help them so that they don't have to be scared to go to the clinic anymore. I remember as soon as all of my people know that I start working there, they start going there for checkup. It's really important to have checkup yearly, if not every couple months. And a lot of older people, even though they're so sick, they don't go to the clinic. because there's no interpreter. They don't feel comfortable. They don't feel safe there. So once they know that I'm there, they start going, and I see a lot of like diabetes people. Their sugar was through the roof. And so I was able to help a lot of them going down. And there are even some that I was pregnant that was almost 20 weeks and they did not go to the clinic, but they went there because I'm there. I ended up moving to pediatrician clinic. Sometimes they even follow me there, and I'm like, I can't help you guys anymore. Like here, they only help people from like under 22 or under 21.
So even when you moved over to pediatric care, the adults still came.
Yes.
They still wanted your help. I mean, that really shows the need for translators. I think it's easy for those of us who have English as a first language. We take it for granted how simple it would be to walk into a doctor's office and say, here's what I'm feeling and here's what's wrong with me. And can you help? And then understand what they would tell us.
Yeah. So that's why if I ever had an opportunity, I want to continue the same line, because even right now, I'm not working in a hospital, but when they had to do a C-section, I don't know where they get my number from. They call me. I've been in the operation room like 3 times already for C-section.
Oh my goodness. Even when you're not working there, you still received a call to come and help out with
I
the
don't know where they
C-section.
get my number. I guess from the clinic that I work. The first one was right after I had my oldest one, and it was 1 or 2 months after I had him, and then it was midnight and they called me, and I'm like, I didn't want to say no, but if I say no and then something happened, so I had to leave my 1 or 2 month old. And after you had your baby, your hormone, everything is still so weak. You're not like 100% there yet.
Yes.
And I remember like just standing there. I'm like, can I just have a chair? I don't think I can stand. They had to grab me a chair, and they even have to give me oxygen. I feel like I cannot breathe. So it was hard. Yeah.
Yeah.
But I just didn't want to say no because they couldn't get any interpreter on the line. And it was emergency because I think it was induction and then turning it to emergency C-section.
Okay. I'm glad that they have you, to call, and that they have such a generous person in you to respond to the calls, as difficult as that is for you. And I really, really hope that you have the opportunity to go back to school and pursue that work that you love, because I can imagine I would imagine that it's not only the language, but it's who you are as a person that helps people to feel at ease and comfortable and safe.
Yeah, I love helping, and I love working with little kids too. So that's why. But yeah, hopefully one day.
Is there anything else that you would want people to know?
I would say we live in the middle, and I'm just so grateful for other resources like the United Way resources. And also there's this church I think it's called Church of Valley. It's a Catholic church that I usually go to for helps. And I found help with diapers. Oh, and a period product and like wipes. So I just want those resources to know that to us, it's a big, big blessing, like a big help. Because I don't know what I would do without them. Like, I don't know what other people would do without them. It's more than thank you for us. Because without them, we have one less thing to worry about, like one less thing to stress about. And then we can focus on our family. I can put those money towards something else too. They're a big, big help.
You're receiving those diapers from those other sources. And is that from United Way as well?
One from United Way, and then I also have to drive to Loveland. I can only do like once a month because of how far it is. It's called Grace Upon Grace Project.
Because you're able to get diapers, what does that enable you to do then?
My kids can explore more than one sport. I've been saving on those. So yeah, that's why he can be on basketball. But right now, we're working on getting him a new shirt because him and his brother are sharing that one jersey. At first, it was for my older boy when he was 4 years old. Now he's about to be 9. So you can see how long the jersey has been in family. It's really wrecked. So it's very short for him now. It's like just little right below his belly button.
That shirt has seen a lot of game time.
It's about to be 5 years.
And how much would that shirt cost?
I think I can't remember because you know how each year things.
Yeah, the price changes,
Yes.
doesn't it?
Now it's probably like $20 to $30. I don't remember. I didn't even ask. I'm like, right now we don't have that yet, so we're still using that.
You've lived through so much and you have shown such courage as well. Just learning the language as a teenager and being dropped into this culture that you had never been to before and caring about your family and now caring for your own family. You really have lived quite a life already. It's a really remarkable story. I'm so thankful for you sharing that with us.
Yeah. Yeah, I'm glad. I'm glad to be able to like share something too.
Thank you so much, Pume. And we wish your boys the best season of soccer. And we just wish your family the absolute best.
Thank you.
Thank you so much for talking with us today.
Yes.
Join the caring power of the United Way of Weld County community. Visit unitedway-weld.org, where you can learn more about our projects, find great volunteer opportunities, and donate. Special thanks to our cornerstone partners, our leadership givers, and the many individuals who make our work and this podcast possible. The music you heard today is by Alex Productions. I'm Diana Smith, your host. Thank you again for listening to the Weld Together podcast. And until next time, remember to be kind to yourself, be kind to others, and remember, even a little good can go a very long way.